Welcome to Micro Health Talks, where we bring insightful discussions on all things that is health and wellness. In the past years, the healthcare industry has seen tremendous changes. And why that was possible? It is merely because of the contribution by the visionary leaders who have paved the way and engraved their name in the history of healthcare. Today, we have one such visionary, the beacon, and he is none other than Mr. Suresh Vazirani, the chairman and the founder of ERBA. Welcome, sir. Welcome to Micro Health Talks.
Thank you.
Pleasure having you on board.
Thank you.
So there's a lot that I would love to ask. There's a lot that the people would love to know about you. We know as you are someone who has led the revolution in healthcare, who has engraved the Made in India concept, who is a pioneer, who is a leader. We would love to know more about you, sir. Why don't you start saying about the journey where it has begun? We have heard a lot about your humble beginning and to the empire that you have built today. So, would you like to share about the humble beginnings of it?
Sure. I'm very happy to be here at Micro Health Laboratories.
Pleasure.
It's amazing what they're doing in so many countries. And I, as a person with a strong conviction for diagnostics as the base of all healthcare in the world. So I'm very happy to see that micro health is able to help millions of people across the world. As I mentioned that ERBA Transasia was born out of the same conviction that diagnostics is the core of healthcare, not only for treatment of disease, but for prevention of disease. And I believe that's where the world is moving to. Gone are the days when you live as you like, and then you land up in the hospital. Diagnostic helps us take charge of our own health. We monitor our health. We monitor our health parameters and take actions at the right time to prevent disease, to control disease. So this is wonderful that we are able to do it in today's world with the use of the technology, which has grown fantastically in last 45 years since I started Transasia. You may not believe that when I started Transasia in 1979, the diagnostics were not really known at all. Most laboratories will just have a microscope. That's about the equipment that they had.
Okay.
And from that to today's high technology
Yes.
diagnostics is something fantastic. And I'm very happy and privileged to be part of this journey from very basic diagnostics to the most advanced, technologically advanced diagnostics. So as I mentioned, this is the new age diagnostics where everybody can go and do the blood test and the other tests and know where they stand.
True.
So I always recommend, and not only that, my dream is that every person in the world does at least one diagnostic checkup every year.
That's very thoughtful.
That's our goal. Even in India, we have been lobbying with the government to make diagnostics as a free, accessible for every citizen of India.
Wow.
So that people can take charge of their own health.
Certainly.
Take preventive steps, adjust their lifestyle depending on what the diagnostic shows. So it's happening, as you know, many states in India have already made diagnostics as free diagnostic services, but this will have a tremendous impact on the health of the world. And as I believe that you can't make a happy world if it is not a healthy world.
Yes, a healthy world is a happy world.
Healthy world is a happy world. Yeah. So our task, all of us here, is to make this world healthy and make it happy.
Happy. Great. So that was very thoughtful. Like, that is why we call you a visionary. So, you have set milestones in the history or in the world of healthcare. So, standing at this genre, when you look back and count the milestones, what do you feel, sir? Can you please share that?
Yeah, as I said, there's been a fantastic journey in 45 years from almost no diagnostic equipment to today, where unbelievable. Every test is done with automatic equipment, so sensitive tests, which 20 years back you couldn't even think about that kind of
Yeah.
sensitivity, that kind of and speed.
Mm-hmm.
Would you believe that in 1979, when I started the diagnostics, ordinary glucose test used to take 4 hours.
4 hours.
Just
And
one
look at-
glucose test used to take 4 hours.
Yeah.
Now you do it in less than 30 seconds.
True.
30 seconds. So that's the journey. And as I say, that this goes with our conviction that diagnostics is the most important aspect of healthcare. And I'm sure a lot more will happen. Next 10 years, you'll see
Looking forward, yes.
further transformation in the diagnostic technology, which I believe that will really revolutionize the healthcare scene.
Yeah.
And make this world more healthy and happy.
A better place to live.
Better place to live.
Yeah.
And happy place.
Certainly. So, having witnessed the traditional methods to the current world of AI, how do you feel, sir, the transition?
AI is going to be the one factor that will revolutionize, because diagnostics is all about various data points. You do X-ray, you do CT, you get so many data points, blood tests, and how do you make sense out of so much data points?
Certainly, yeah.
I mean, doctors are a billion people, but every human being has a limitation on how much data they can collate. With AI, that transforms the ability to connect all the dots and come up with a, good diagnostics.
Better outcomes.
Yeah, better outcome in a short time. So that's what AI is going to do, that, connect all the technological things we have and make it meaningful for the patient.
Certainly. So you believe that AI would enhance the future of healthcare?
Absolutely.
Certainly. That's great. So, we know that you are a philanthropist. So how would you love to known as a businessman or as a philanthropist or as a visionary?
I started Transasia pure out of conviction to serve the humanity. That was the
Ultimate.
upbringing. So earlier I was doing different things, but I said, how do I continue serving my country, my people? And I said, diagnostics is one thing if I want to see a happy world.
Great.
So that conviction still remains. That's still my dream. That how do I continue to be of service to the so for me, philanthropy is not really something different.
It's a part.
Yeah. So I don't say that I run business, make money, and then spend it. It's not two different things. Just one.
That's thoughtful.
That's so what we call the, one purpose.
Certain.
So the bigger purpose is still serving the people.
Serving the people.
And through our business, how we can do that. So business and philanthropy is one part.
Goes hand in hand.
Hand in hand, it's the same thing. Recently, one of the big projects we are doing is we realize that in India, we don't really have a technological base. If you've seen, almost all the medical technology is developed in the Western world. While a lot of patients in India, 1.4 billion people in India. So I said, that's not quite correct. How do we develop technologies in India?
In India,
Manufacture them and do that.
It's the Made in India concept.
But we make in India, we started making equipment in India since 1991. We were the first ones in the country to make in India. But make in India is only one part. Where do you develop the technology, the research? That's a key. You see?
Yeah.
So unless we do that, unless we develop in India, research in India, the make in India is only a half the story. To complete the story,
There's
we
a
have
lot
to
to
have
do.
research in India. We find that very little is being done in research in diagnostics or medical technology, and we don't have that kind of training universities ecosystem to encourage that. So I believe that that has to change. And my personal belief is that, whatever you want to do, don't wait for somebody else to do it.
Okay.
So I say, I'm not going to wait for somebody else. This has to be done. If nobody else, I will do it.
Wow. That's a message.
So recently I decided to start a university,
Oh,
University for Medical Technology, specialized university,
great. We would have to know more on that. So please.
Medical University for Medical Technology in Visakhapatnam.
Okay.
And this coming up in July.
Oh,
In this year, July, we will start.
congratulations on that. That's very thoughtful
you.
of you. Okay, sir.
Yeah.
So you're commencing that in the month of July.
Yes.
So can you tell us more on that?
As I mentioned, the whole purpose is to encourage people to think of research and science and make them, equip them. So this would be a unique concept where the focus is on developing new medical technologies.
Okay.
Yeah. And we'll have the not only masters but also PhD in medical technology. That's what. And we have a global faculty
Okay. Wow.
for this one. So we have three Nobel laureates who will be on a board, and many other scientists from across the world who will inspire young people to make,
Yes, to do more.
to aspire to be
Yes.
great scientists and engineers. Yeah.
Great. Okay.
So of course this is just the beginning. Setting up university is just the beginning.
Okay.
The end result is takes time, but I'm sure that in 10 years time.
You're gonna bud a future.
That's right.
Yes, that is thoughtful. So, like, can you also tell us, like, to the budding entrepreneurs or the people who are looking up to take the journey in the field of healthcare, what is the one message that you want to give to them?
Yeah. Well, message is one part. I believe that you must walk your talk.
Okay.
So
is that your mantra in life?
So as I mentioned, that if you look at the diagnostic scene in India, almost every engineer is trained at Transasia.
Oh.
So that engineers trained at Transasia, now you find in every other company, diagnostic company in India. So I believe that Transasia is like the mother trainer for all this one.
Okay.
So that's wonderful. Not only that, many people who are working at Transasia have started their own companies, encourage their entrepreneurship.
Okay.
So that's wonderful to see that, how Transasia has helped many other entrepreneurs set up companies, diagnostic companies. And because our goal is not to make Transasia successful. Our goal is to make India successful.
It's for the community.
Yeah.
Great.
So if that happens, that's what makes us happy.
Certainly, sir. Like you emphasize a lot on happiness, health,
Yes.
philanthropy, and community.
Right.
For the community. So, how do you all jot this together? Like, how do you balance this? That is one personal question that I've got.
Yeah.
And you're saying about the journey of 45 years.
That's right.
And you're still like energetic and magnetic. Like, what is the one goodness of this?
Well, I believe each one of us is born in this world to do some positive contribution to the world.
With a purpose.
Yeah, we are not here just to come, live, eat, die. That's not really. I mean, why are we different from the animals? That God has given us different roles. So we have to do something more than just live for ourselves. So that's what I try to practice, remind myself that I'm not here just to live a good life and happy and that's it, but also to contribute to the world, other people, and earn some good karma.
You believe in karma as well?
Yes.
Okay.
So I tell the people in my company that we are lucky that we are helping save lives through our work. So that way, each one of us getting 2 salaries. We get 1 salary in this life
And
and 1 karma for next life.
certainly.
So we get double salary.
Okay, great. So, sir, like you're in this journey of 45 years, you have seen tremendous changes. And what do you think is the future of healthcare? What next is in hold for us?
As I mentioned that, of course, we have fantastic technology. But how do you make it affordable and accessible to the ordinary people? That still remains a challenge,
Challenged, a little bit.
especially in developing countries. So technology is as good as it reaches its destination. But I believe there we have a long way to go. We still have technology is fantastic, very helpful, but 70%, in India, still 70% of the population hasn't done blood tests.
Okay, that is
70%.
Yeah, that's alarming. Yeah.
Yeah. So that means our technology is only on the books. It hasn't touched
Not in practice.
the lives of 800, 900 million Indians. So how do we get it to them? So that's where, my goal has been to how do we make it affordable, accessible for everybody in the world.
Yeah, we wish you all the best for that, and we wish we can collaborate and contribute and go hand in hand with the vision that you have got to reach the nook and corner of the world, to reach every people, to touch the lives of people for a healthier and happier tomorrow.
Thank you. That's what wakes me up every Monday morning. I said, "Chalo, kaam pe lag jao."
Yes.
No rest for the devil. Chalo.
Okay, so I have been said that. So, one more question. Since you have told about this Monday morning,
Yeah.
what is your take on work-life balance? Since that is a hot topic we discuss worldwide, what's your take on work-life balance, and what do you have to tell to the working class of the world?
I believe that work and life cannot be two separate things.
Okay, again,
We cannot put a compartment. This is my work and this is my life. If you can make work and life one purpose, then it's a lot more meaningful.
Okay, the purpose is served.
Yeah.
Okay.
As long as you remain a split personality, you do one thing at work and one thing then
No.
you'll never be happy.
Okay, it's a blend of both.
It has to blend. You have to combine the two into one bigger purpose.
Okay.
Yeah.
Okay. Thank you so much, sir.
Good.
Like you have touched different subjects on happiness, on health, on work-life balance, about the future, about the history. What a conversation!
Thank you.
Thank you so
Thank
much
you.
for having with us. So
Thank you for having
enlightening
me.
us.
I really enjoyed
Pleasure.
meeting you all, and
Pleasure.
I wish you all the best.
We are so privileged to have you on board. Thank you so much. With that, it is Micro Health Talks for Precious Life. Thank you.